Good morning. Thank you for joining our information session today to learn more about the collaboration with Carlow University's nursing program at St. Vincent College. My name is Melissa Sobek. I'm the Associate Director of Admission at St. Vincent. Joining along with me today is Nursing Director and Instructor, Mrs. Carla Thomas, with current student at St. Vincent, Nicole Abrams, who just finished her freshman year at St. Vincent. Today, you will have the opportunity to learn more about why you should choose to do a nursing degree at St. Vincent College with Carlow University. During the second part of the program, you will have the opportunity to ask our panelists questions. You will find a Q&A button located at either the top or bottom part of your screen, depending on your device. It is now my pleasure to introduce to you Mrs. Carla Thomas.
Good morning, everyone. Thank you for joining us today. I'm Carla Thomas. I'm the coordinator of the program and faculty member and the academic advisor for all students in the program at St. Vincent. Just to highlight the program a little bit, to give you some information, we do require a high school GPA of greater than or equal to 3.0 and a combined critical reading and math SAT of at least 1060 or an ACT of at least 21. We have a very rigorous program for preparing students for the NCLEX, which is the licensure examination. I always want to make sure that students understand the importance of preparing for the NCLEX, because regardless of the grades you get in your nursing program, you can get really good grades and pass the program and graduate, but you can't practice as a nurse until you pass the NCLEX and obtain a licensure with the state in which you choose to practice. So it's really NCLEX preparation begins in the freshman level in the nutrition course with a very rigorous program with questions that are very similar to what you will see on the NCLEX. And the NCLEX prep is embedded throughout the program, which I will highlight a little bit more when we get to the curriculum guide that shows what each semester will look like. And then in the senior year, you will each be assigned a faculty mentor to help you with preparing for the NCLEX. So this is just I know it's a very busy, a lot of information, but this shows what each semester will look like for you in the nursing program. You can see that nursing courses start in the very first semester with a 1-credit introduction to nursing called Professional Issues, and then 2 courses in the second semester of the freshman year. And then anything on the guide that you see with a +1 or a +2 is a course that has clinical attached to it. So you will have time in our nursing skills and simulation lab coupled with real live patient care experiences at Excella Health. One exception to that is in the 3rd year fall semester, the NU 3161 Nursing Care of Children and Adolescents. That clinical course will be at UPMC Children's Hospital in Pittsburgh, which gives you an excellent pediatric experience. You'll also see that there is a +2 in the fall of the senior year. That's 120 hours in an intensive care unit, which is unique to this program. Critical care is not required in undergraduate nursing, but students really feel like it's a course that gives them, helps to put all the body systems together and understand what's happening with patients. So that's a course that sets us apart. And then in the final semester, the NU 4111 course has 120 hours of a preceptorship where you are paired with a nurse and you work that clinical practice area, that nurse on the unit where the nurse works, and you work 120 hours of that nurse's schedule. So those are just some highlights. You can see there are a lot of science courses. There's a quantitative reasoning math course and then basic applied statistics. So those are the only math courses that are required. and quite a few science courses, anatomy and physiology with lab. And so that's just a little bit of an overview. Community health is in the senior level. And you can also see that in the senior year, there are 2 1.5 credit NCLEX seminars. So in your senior year, you get 3 credits of coursework that's dedicated to preparing for the NCLEX exam. So you may be wondering why it's essential that you obtain a baccalaureate degree in nursing. You know that you can become a nurse by going to an associate degree program, say at a community college, or you can go to a hospital school of nursing and receive a diploma. There is a lot of research that shows that the best practices in nursing are with a baccalaureate degree. And many hospitals are changing their policies to require that students have a BSN. This is especially true of any hospital that has achieved magnet status, which is says that the hospital excels in nursing care, and there are several of those throughout the United States. Excella Health just recently achieved magnet status, Children's Hospital, West Penn, several hospitals in Pittsburgh that have achieved magnet status. And having a magnet hospital requires that 80% of your nurses are at a minimum of a bachelor's degree. So it's highly recommended that you go that route, which is what you'll get at St. Vincent. So what's so special about a Carlow BSN? Excellent reputation for educating professional nurses, the highest NCLEX pass rate in out of all of the Pittsburgh nursing schools for the past 5 years. Lots of our students go on to graduate programs in for nurse practitioner, nurse anesthesia, nursing education, many different routes for graduate program. And as I highlighted a little bit earlier, 120 hours of critical care clinical experience. If you have any interest in pursuing nurse anesthesia, you have to have a year of a year of professional practice in an ICU. You're much more likely to get hired in an ICU if you have had a critical care clinical experience in your undergraduate program. So we are currently building a skills and simulation lab at St. Vincent, where we will have mannequins that talk, a mannequin that gives birth, a number of different experiences where you will have low pressure to make clinical decisions and be able to translate those into your own clinical practice. So as I mentioned, highest NCLEX pass rate in Pittsburgh for the past 5 years, 100% pass rate in the class of 2017 and 2018. We also offer a number of summer internships, perinatal, perioperative, and gerontological internships at local health centers. We have a step ahead program which allows students to take graduate level coursework while they're in undergrad. And we are exploring a number of travel abroad experiences as well. So these are just some testimonials. This is a graduate of the class of 2017 who sent us an email after she finished the program. I wanted to let you know that I passed the NCLEX in 75 questions, which is the minimum number of questions you can get. I started orientation for UPMC yesterday. I will be working at Shadyside. I'm so grateful for everything that you all taught me. I still hear your words in my head when doing anything nursing related, and I did especially when taking the NCLEX. Again, thank you for everything. Carlow has an amazing nursing program, and the NCLEX prep works. I will never regret the decision that I made to choose to go to Carlow. You all made the difficult journey of nursing school so much easier. Thank you for your support, wisdom, encouragement, and belief in me. And another testimonial from a graduate of 2018. Hi, Mrs. Thomas, sitting in orientation for the cardiac ICU in New Jersey. I want to thank you and the faculty for everything, every topic we've covered so far this orientation were topics heavily covered in critical care class at Carlow. Having critical care for a whole year was extremely beneficial, and I'm so thankful for my education from Carlow and the faculty's dedication to sharing their knowledge. I just had to let you know that I feel thoroughly prepared. So that's the end of my PowerPoint presentation.
Okay, great. Thank you so much, Carla, for that information. We're now going to open it up to our audience to ask questions to our panelists. Again, you can find that Q&A button located at either the top or bottom of your screen. Click on it, a box will appear, type your question, and our panelists are ready to answer those for you. All right, so it looks like we do have a question coming in already from Gina, and this is going to go to you, Carla. She would like to know, it's a two-part question. Where are clinicals, where do you do them at, and when do you start your clinicals?
So clinicals are mostly at Excella Health. So that's Excella Latrobe, Westmoreland, and Frick hospitals in Westmoreland County. So close by to the college. And the only exception to that is in the junior level, the nursing care of children and adolescents will require travel to Pittsburgh for an experience at UPMC Children's Hospital. And the reason for that is just because it's such a robust experience for the pediatric population. It's a total of 60 hours, and the way we have it set up is it will be 6 10-hour days. So they're long days, but it only will require 6 times that the students have to travel into Pittsburgh. And clinical courses start in the fall of the sophomore year.
All right, great. Thank you. We have a question coming in from Dina, and she wants to know, and again, this is going to go to you, Carla. What is the benefit of attending St. Vincent College instead of just going to Carlow?
So there's a couple things that I think really stand out. One is the environment. It is the same curriculum. However, when things open up again, the biggest thing that I think is really important for you is to visit both campuses, because you'll see that Carlow's campus is a very urban environment, right? Kind of on the main drag in Oakland. And it's sort of a hillside with buildings built into the hill. There's very little green space. It's just not, it's not a real, it's an urban setting. Whereas at St. Vincent, it's more of a rural setting. There's plenty of green space. So it's really just a matter of what you're looking for in terms of your living environment. But the biggest thing is the size. So we are not, our limit for acceptance at St. Vincent is 30 students. Carlow will accept as many as 75. So you get a lot of very individualized attention. You get to know the faculty really well. And I think Nicole can speak to that it's really very good to be in class with the person that's teaching you, also being the person who runs the program, who is your academic advisor, who gets to know you by name. If you don't come to class and I don't know you're not coming, you're going to get an email saying, hey, Nicole, I noticed you weren't in class today. Is everything okay? Is there anything I can do to help you? They drop by my office, sit at my table, have some candy, just chat. So you get a lot of really individualized attention. So I think that's the biggest difference.
All right, thank you. Yeah, and let's get Nicole's perspective on that. Nicole, why did you choose St. Vincent College instead of just going straight to Carlow?
So I know that I wanted to go to Carlow since like my junior, sophomore year of high school, because I knew the program of it was awesome and I loved everything about it. But when I visited Carlow, I do live in Pittsburgh, but I'm not a city person. Like I don't like all the buzzing cars at night or like the sirens of all the like ambulances that run past every 5 minutes. So when I visited St. Vincent, I was like overwhelmed with like green spaces and everything that was open and trees. And I was like, that's exciting. And personally for me, I belong into a marching band and they have that for me too at St. Vincent and not necessarily at Carlo, because Carlo really does not have a marching band per se or those athletics that I enjoy. So St. Vincent for me was the better choice for the same exact curriculum, and for it's perfect for me.
All right, great. Thank you for that answer. All right, we have another question coming in from Jasmine, and this is going to go to you, Carla. She wants to know, what's the pay difference between having a 2-year degree as compared to having a 4-year degree?
So there is none, none in Western Pennsylvania. If you just choose to work outside of Western Pennsylvania, especially in another state, there may be a pay differential. And there also, you will have a much harder time obtaining a position if you don't have a BSN. That's true outside of Pennsylvania. Pennsylvania has more diploma schools than any other state in the United States. So that's the reason why they do employ a lot of associate and diploma graduates. However, those people are told that they have so much time before they have to get a BSN. So that's another added pressure when you are a new graduate. You have to learn a new job and jump right back into school, which is tough.
Right, and as if you're getting the BSN, you can just start employment right after.
Right, exactly.
All right, great. Well, another one's coming to you, Carla. It's Harley, and she wants to know, what would you say makes this nursing program unique and different from other programs? That's a great question.
So once again, the size. I really think that's the biggest difference, is just the individualized attention that you get from being in a classroom. You also get a lot of camaraderie with the rest of the students in the cohort. And that's probably something else Nicole can share. You get to know your peers very well. You set up study sessions. You live in the dorms with other nursing students, and you see those students in multiple different classes, and you can make arrangements to study together, to go to study sessions for your science courses, and you really form strong bonds with both the faculty and with the students in your cohort.
All right, great. Thank you. Nicole, do you have anything to add to that, being with the same group of students, your experience?
I know for me at least, a lot of our classes are kind of the same. So I'm with the same group of about 25 kids, probably all throughout this whole program. And I know already that I've made great bonds with at least half of them. I know everyone by name at this point, and I know exactly who I want to study with, how to study. And I know if you come to St. Vincent, the freshman resident hall has this great study space at the bottom with all the whiteboards and a TV. And I know a lot of us have gotten together and just had like a big study session together with snacks, with a big whiteboard, and we passed most of our tests together. So it's like a great experience.
Right, good. Yeah, you definitely need to have that bonding with one another, not only with your academics, but also outside of the academics too, and just to de-stress, and you're all going through this together. All right, Jasmine has another question for you, Carla. Can you tell us more about the internships available?
Yeah, so the internships are really a neat experience. They are not required. However, they really help you to secure employment in those specialties once you graduate. So the gerontologic internship is with Presbyterian Senior Care in Oakmont, and you're eligible for that in the summer after your sophomore year. And you do get college credit for it, and Presbyterian Senior Care will also offer you employment so that you can make money and work there in addition to the internship and after the internship. The peri-operative internship is an awesome experience that is offered through UPMC, and the it gives you the opportunity to spend time in the operating room learning to be an operating room nurse, and that you are also eligible for that following your sophomore year. And several of our graduates who have completed the perioperative internship have gone right into the operating room as new graduates, which is not typically the pathway. Usually you need some experience as a nurse before they'll consider you for the operating room. And then the perinatal internship is through McGee in Oakland. And that you are eligible for following your junior year, which is you follow a pregnant woman through her pregnancy and delivery of her baby. So that's an awesome experience as well.
Oh, wow, that is very impressive. All right, one other question we have coming in is from Dina again, and she's a junior in high school, so she didn't take her SATs yet.
Okay.
Will this hurt her chance to be admitted into the program or into St. Vincent in general?
So you will, in order to qualify for the nursing program, you will need to take the SAT and achieve a minimum of 1060, or the ACT to achieve a minimum of 21. It's one or the other. So, and with being a junior, you do have plenty of time. I know right now the testing centers aren't open, and that is a challenge for students. But since you're a junior, you have plenty of time. And I'm sure those testing centers are going to reopen probably soon. I just finished Carlo's nurse practitioner program, and we were just notified that the nurse practitioner certification exam testing centers are starting to reopen, and they're going to have social distancing. So they'll be at about 50% capacity. They just won't have as many people testing at one time. But I expect that the SAT, ACT testing centers will be reopening soon as well.
Right, I agree with you, Carla. For my juniors that are listening, if you haven't had a chance to take your college boards yet, do not panic.
Nope.
College Board is doing everything to assure that you will be able to take those tests. And let's say that the schools do not open for the fall. They are looking into doing an online assessment. So you will have the chance, and definitely we will consider that when you're looking to apply, whether it's just to the nursing program or you decide to come in undeclared or another major. Okay, Nicole, we have a question for you. How do you find time to balance the academics and when to have fun at St. Vincent College?
So honestly, it wasn't that difficult for me at least, because I kind of pressure myself a little bit on my academic side. So I know when to hunker down and really study that information. And I know, like for me, I study better in a group setting. So if I know I have to memorize something really quickly, or I'm kind of like procrastinating a little bit, I'll get together with a couple of my friends, and then we'll all study together, which is kind of like relaxing as well. Like, cause you're all together, you're having fun together. And so you'll know that, weekends are like time to have fun and relax, and then test week, not so relaxing. And I know it's kind of hard to get into the groove when you first get on campus, but once a month rolls by, you'll be smooth sailing.
Great. And Taylor wants to know, she mentioned that you were involved with band, and she's interested in doing marching band as well. What's the commitment like for marching band?
Oh, wait, can you repeat that again? It kind of glitched out.
Taylor is also interested in doing marching band while at St. Vincent. What's the commitment? Marching band practices?
So honestly, from last year, last year, it was actually a class. So the commitment there was a lot more like practices from like, the practices are gonna be kind of scary, but they're from 9:30 at night to 11 at night, because that's when people don't have classes. And that's kind of crazy from a high school standard, because high school you would do it right after school from like 2 to 4 maybe, but now it's like at night. But it's kind of like a transition. You'll get used to it. But for next year and going on, it's going to be a club. So I doubt that there's going to be so much of a stress to be present all the time. But if you love marching band, it's like a commitment to show up. And there is band camp in the fall that we do get to go on campus about a week or a week and a half early anyway. So you get to meet everyone from the marching band before all the freshmen come on campus. And you'll have a new family before even you meet all your new family in your pods that you'll get. And I know that transition was really cool for me too, because I got to move up all my stuff a little bit early, which is kind of nice.
Yeah.
So that and all that commitment, it was definitely worthwhile for me, and I'll be doing it again in the fall. So
Wonderful. Are you involved in any other activities or clubs or anything within your major at St. Vincent, Nicole?
I try to get involved. I'm not necessarily like a leadership role in anything for the fall or any like that, because I'm kind of focusing on my academics a little bit more because that's how I am. But I did participate in APB a little bit, which is the Activities Programming Board that's on campus. I was in their committee, it was really fun to do. I actually applied for the orientation committee for next fall, which is really cool because I'll get to meet all the people who are coming on campus for next fall again, all the new freshmen. Which I also did like a craft club, which was really fun because they would do crafts every week, and that was another thing that helped me relax on campus. I love painting, I love doing artsy stuff and stuff like that. There's a ton of different clubs out there. There's so much to be offered there. It's incredible.
Thank you. It seems like you're involved in just enough. Again, you don't have to be involved with everything under the sun. You don't even have to be part of any clubs. You can just go to the different activities that are being offered around campus. Okay, Carla, Chad wants to know, he's interested in being a nursing major. Is he going to be outnumbered by being, only a few males in the nursing program? Is it more female dominated?
So, for right now, I believe we have 4 or 5 gentlemen in the program, which, so it is, the females do outnumber the males, and that's nationally, that is still the case. So I can't really, I can tell you what it's like now and what I've seen in my, almost 20 years now of nursing, teaching nursing students, that it is the women still outnumber the men, but there seems to be a few more men each year.
Right. All right, good. And Craig wants to know, he said he heard from a friend that he has to take a foreign language at St. Vincent. Is that the case if he comes in as a nursing major?
That is not true for nursing. I believe it is true for other majors. The admissions counselors can help you with that, Craig, but not for nursing. Nursing is a bit unique in that all of the liberal arts colleges have what's called a core curriculum. So there's core curriculum requirements, and then there's requirements for your major. And because your degree comes from Carlo, the courses you take for the core, they are all St. Vincent courses, but they are based on Carlo's core requirements. So there are no language requirements in the core curriculum for nursing at Carlo. So as a result, you are exempt from a language at St. Vincent.
All right, thank you. Yes, so if you are a nursing major, you do not have to take a foreign language, but if you come in under any other program, you will have to do a foreign language. Thank you. Okay, so Carrie wants to know, Carla, is she able to specialize in a particular area of nursing while doing the BSN?
No, and that's national as well. That is not unique to St. Vincent. Every nursing program prepares you to be what's called a generalist. So when you graduate with your BSN, you can be a psychiatric nurse, you can be a neonatal nurse, you can be a pediatric nurse, a geriatric nurse, critical care nurse, but specialization does not happen until the graduate level in nursing.
Okay, thank you. And Jasmine has another question. Thank you for your questions, Jasmine. Carla, do you recommend that she take a foreign language to better prepare herself for the work field? And can you do it if you would like to?
So if you would like to, you certainly can. There's not a lot of room for extra classes in the nursing program. We're all held, every nursing program is held to kind of the same requirements from the accrediting agencies for nursing. So there's not a lot of room for elective courses. However, if you wanted to take a foreign language, I'm sure that we could work it into your schedule, especially if you've had any AP courses that will count, or college and high school, or anything like that.
Okay, thank you. And I'm sure they could probably try to do that in the summer too. If they,
Oh, you could also, absolutely can do it in the summer.
all right,
Sure.
great.
Yeah.
All right, Gia has a question for Nicole, and she says, is there any piece of advice you could give her about college that you didn't know coming to St. Vincent, or just about college life in general?
Honestly, try to make good friends. Like that's a good thing. I would say a lot of people you're going to meet a ton of people, but if you stick to a couple of people that you can trust and really like bond to, like your roommate that you're going to get, or just anyone who's on campus, could be upperclassmen, lowerclassmen. If there's people there, they want to help you out. Like go for the new opportunities, try new things. I know for me, I really didn't do much up until probably the end of my fall semester, like with activities or anything. And I feel like I should have joined a lot more, and branched myself out more in like clubs and met a lot more people than I had in my fall semester, because I was kind of trying to be a little bit more secluded, focusing on my schoolwork. But college is the time to branch out and really try to make who you are.
All right, great, thank you. And that seems to be all the questions that we have. I want to thank Nicole and Carla for sharing that great information to our attendees today. If you do happen to have any more questions, you can always reach out directly to Carla or Nicole or your personal admission counselor. Actually, we have one more question coming in from Marie, so we're going to give this to Carla. Doing well, this might be actually for me. What are you doing for scholarships now that the
Yeah.
ACTs are waived? Yes, I will answer that one if you don't mind, Carla.
No, I don't know the answer, so.
Okay.
Thank you.
So yes, right now, if you are applying to St. Vincent College and you cannot take the SATs or ACTs, we have three options for you to be considered for admission. Obviously, we're still going to look at your criteria. You have the option right now doing a virtual interview with your personal admission counselor. And you also have the option of writing an essay, submitting a paper from a class, or answering a prompt. And you could find this information on our webpage at www.stvincent.edu and click on the admission tab, and that will give you an overview of how we are reviewing students. And then we will factor in the scholarships by looking at the GPA still and determining from there. All right, thank you again. I think now that is our last question. And like I said, you can always contact directly or your personal admission counselor, who would be happy to help you. And if you haven't made your final decision for the fall and you are ready to join the Bearcat community, please log in to reserve your spot, and you can find that link at www.stvincent.edu/deposit to reserve your spot in the freshman class. And again, we thank you for taking time out of your morning to hear and learn about this great collaboration between Carlow University and St. Vincent College. Please know that we are thinking of you and your family during this difficult time, and we are excited for you to be on our campus very soon. Thank you again, and enjoy the rest of your day.